Good evening, doctor. Thank you for being here with us today. I want to discuss the very untouched topic of dental health combined with mental health with you today. Before we begin, could we please know a little bit about you?
Hi, Priyal. I'm very impressed that you're doing this for everyone, and thank you for inviting me to this forum.
Thank you so much.
I'm Dr. Oh, I'm Dr. Roopam Garg. I currently practice as a family dentist in United States. I'm from Texas, Dallas, Texas, to be very precise, and I've been practicing since 2005. I did my DDS here and from NYU College of Dentistry, and I own my own practice currently.
Thank you so much, doctor. I will now begin with the questions. We can start by discussing like the connection between dental health and mental health. So, like, how does poor dental health affect mental health?
So it's very common saying that the first thing that you notice in a person when you meet them for the first time is you notice their smile. So if you are missing teeth or the gums are not healthy or anything associated with mouth, definitely pain comes in, loss of self-esteem. If you have missing teeth, people don't want to smile. It just kind of affects their self-confidence. A lot of people stop socializing. That adds to their mental health problems. If you're not meeting people, if you're not eating properly, so that all adds to psychological issues. And if they have existing mental problems, then it just kind of exacerbates that, and it can kind of makes it worse.
This is like
So
very interesting.
yes, I've seen so many cases like that. I had actually a friend in high school who kind of broke her front tooth while playing. And then we didn't see her smile till for years after that, till she got a crown in front. So she used to kind of hide her smile, by just kind of not being able to open her mouth. And so, you could see that it had kind of put a dent in her personality and the way she was kind of behaving in general.
This is like a very untouched topic. Not many would think that even this is related, but yes, it is deeply related. Uh, the next question is, what are some common dental health issues that contribute to mental health issues?
So first thing that comes to mind is cavities. Cavities, if they are deeper, they can start causing pain. It can lead to losing your teeth. Second thing is gum disease, loose teeth, bad breath. That can also lead to, losing rest of your teeth. A lot of people I see without teeth because of gum disease. Another thing that can, affect a little bit is dry mouth. A lot of our elderly and, adults take a lot of medications that can cause dryness of mouth, that can lead to more cavities and hence loss of teeth. Another thing that I can think of is teeth grinding. A lot of people have started grinding their teeth in their sleep. That kind of causes loss of tooth structure, and all these things kind of add to loss of tooth structure, pain, discomfort, which can in turn affect their mental health.
That is very concerning.
Yes.
In what ways can poor dental health, like you talked about it before, affect a person's self-esteem and social interactions?
So, as I had mentioned before, people may start avoiding social interactions. They start avoiding people because they don't want them to, people to see that they don't have teeth. Another thing is they're not able to eat properly. So, my father-in-law recently lost all his teeth. So he became so, disheartened and depressed when he got his new dentures because he couldn't taste his food. He couldn't eat it properly. He was on a very soft liquid diet. He couldn't enjoy the normal foods that he used to enjoy. So that also adds on to it. Your day to day. A lot of people are foodies. A lot of, food is your important part of your life. So if you're not able to do that normal basic thing in your life, that really affects you on a mental level. And when you socialize, food is one of the bigger things that you socialize over. So if you have to bring your own crushed baby food, and you're not able to enjoy with others, you're not able to enjoy samosas and crunchy food stuff, then it really really kind of makes you feel, why am I going to a party, why am I, so you just kind of start restricting yourself to home and sit by yourself, and that really starts affecting you mentally. Then slowly, when you're avoiding seeing people, you are away from all those relationships and all that. And, you just become so isolated over time, and depression hits, and a lot of things can get triggered from there on.
Thank you, doctor. And before we conclude, can you provide our audience with like any guidance or advice, preventive measures to take care of their oral health and mental health simultaneously?
Oh, this is a very, very good question. So, recently studies have found out that, people who have Alzheimer's, which is one form of dementia, the same kind, they had very high numbers of bacteria that is found in gum disease and cavities. So they found a direct correlation between Alzheimer's and gum disease and all that. So it's very, very important that we all maintain our gums so that in future we are not kind of going down, that lane of get contracting Alzheimer's. So very, very important to brush and floss at least once and brush twice. Another thing we don't pay attention is to our diet. We have started eating so much processed foods, which is just laden with sugars and carbohydrates. And that really, really is biggest causative agent of cavities. So if you can, start eating healthy snacks, try to avoid processed foods, sodas, all those things, then we definitely will be kind of preventing a lot of cavities. Another thing that I have found is very difficult, in India is people don't visit dentists regularly for their checkups and cleanings. There's a little kind of misconception about, you only go to a doctor when you are in pain, but prevention is better than cure, as they say. So visiting a dentist every 6 months for your checkups and cleanings, catching those issues very early on so that they can be treated and prevented from going down into bigger issues is very, very important. And lastly, one more thing is, if people can stop smoking, which has direct effect on bones and gums, that will be great. Tobacco is one of the biggest causes, not only of oral cancer, but also gum and bone issues.
Thank you so much for the advice, doctor. This talk has been very helpful and I believe insightful for everybody who does not know that oral health is as important as physical health is. Thank you so much for being here today and like enlightening everybody and taking out your time for us. Thank you so much.
Such a pleasure to be here, and my good wishes and best wishes are for your future endeavors. Thank you so much for having me.
Thank you so much, doctor. Thank you so much.
Okay. Bye-bye.